Hello, everyone. Thank you very much for joining us. My name is John Lin, Sunrise Urology here in Gilbert, Arizona. I'm a private practice urologist. If this is the first time you're watching us, thank you for watching. And if you are a repeat watcher, thanks again for following it along on our Sunrise Urology Facebook page. As a urologist, as a physician, I like to think I know the patients the best. I spend the most time with our patients, but that is simply not the case. Today, I have here in the studio, Mackenzie Horan.
Yeah.
I always screw that up. Mackenzie is a certified nursing assistant. Now, I never thought much about CNAs. I always knew that they help nurses, but I had no idea what went into the certification process and the fact that they spend the most time among all healthcare workers with the patients. So welcome to the studios, Mackenzie.
Thank you. This is so exciting.
Yeah. So tell us about how you got into the CNA certification and the process.
Well, I had taken all of my prereqs at community college to get into a nursing program, but all of the waiting lists are super long to get into nursing schools. So I wanted to get my foot in the door, and I decided that getting my certified nursing assistant would be better because a lot of places will either help or pay for all of your schooling. So that was the main thing. And then I also talked to a lot of family members who they kind of started from the bottom and worked their way up, and they said that you gain a lot more respect for each position the lower you start out. So that was the main thing. Was I wanted to start working in a hospital while I was waiting to get my degree, and just be with patients and start working and see, mainly to make sure that I was making the right choice being in healthcare.
Okay, so so this is kind of like the first step in your process of getting further into healthcare. And
Yeah.
CNA is just, you thought this would be a good way to get your foot in the door and get used to how things work.
Yeah, exactly.
Okay. So when did you decide to pursue the CNA degree?
Actually, it was in January.
This year?
Of this year. I did
No
not
kidding.
sign up for college classes. I feel like when you do college, I feel like everyone in general kind of goes through the stage where they're like, I don't know where to go next. I completed all of my prereqs and my co-reqs, so I didn't really have any other classes I could take. And so I kind of sat around and I was like, well, I don't want to waste this time. And so
You don't know what you want to do.
Yeah, exactly. So I decided I was going to look up CNA schools. One of my friends had gone to Arizona Medical Training Institute, and I talked to her about it, and she said it was awesome. And so I looked at the classes, and I started my class on March 5th, and I ended on April 16th. That's when I took my final. And I took my boards April 26th.
Wonderful. So
Yeah.
you passed your boards and
Yeah, I passed my boards with a 97 in the written and a 100% on skills.
that's phenomenal.
It was awesome. I was so excited.
You were a gunner. We call these people gunners in medical school who excel. And
Yeah, it was just so fun for me because like the classes, like it was a 6-week course, so it was hard. And every Monday and Wednesday we had an exam. So we would lecture, and then Tuesdays and Thursdays were skill days. So you didn't really have time to study those days until you went home. But I loved it. I did not think I would do nearly as well as I did. And I did, and I also took my boards the day before I was getting my boards results the day before my 21st birthday. So I was so nervous because I was like, this is going to make or break my birthday. But I found out at my birthday dinner, and it was super exciting.
Good for
and
you.
And then you think that's where the excitement is, like, that's what you're waiting for. But then you have to send in your application, and then you have to get everything sent to the Arizona State Board of Nursing, and then you have to wait for your license number to do anything. So you're waiting anywhere from 2 weeks to about a month.
Sure.
Mine was about a month before I even got my license number.
Well, the main thing is you pass the exam,
Exactly,
which is the big hurdle, and then the rest is just kind of logistics and
Yeah,
headache.
it's just like you're just kind of sitting there like, oh, when can I start? Like, what can I do? But yeah, it was an insane time. 6 weeks and then boards. It was crazy.
All right, so before we get too far ahead,
Right.
tell us about what CNAs do. What do you do? I know I did a little bit of research. I know it's state dependent. in Arizona, what are some of the things that you can do?
Well, so that would be called like our scope of practice.
Yes.
And it's easier to name what we can't do. Like we can't insert or take out tubes. So catheters, IVs, anything like that. We mainly help with the most intimate details of a person's life. So dressing, using the restroom, helping them, do anything in their day-to-day lives. We cannot give them medicine, though. So that is on the nurse to do, or I believe that a caregiver can give medication, but a CNA cannot. So we're basically just in there helping them live their day-to-day life, doing things that they can't do for themselves.
While they're hospitalized, while they're in a... Now tell us about where do CNAs work? I know I've seen them in the hospitals, but where else do CNAs work?
So CNAs can work in hospitals, they can work in long-term care facilities, and assisted living, and rehab facilities. There's a lot of places that CNAs can work. You just don't see them a lot. They're kind of more behind-the-scenes people.
It seems like it.
So they're usually going to be the people that you just see darting from room to room, taking care of multiple patients, because usually when you're in a facility, you're not just in charge of like a couple patients. It's anywhere from 10 to 20, because there's rooms that have 2 patients, there's rooms with 1. It really just depends on like where you work.
Mm-hmm. So so during your training, so you go through your 6-week course. Let's talk about the program. How do people become a certified nursing assistant?
Right. So
I know you went through the 6-week program.
Yeah, so you choose your school, and there's multiple programs, specifically through Arizona Medical Training Institute, where there's a daytime course, there's a weekend course, which is like a 3-week course, and then there's the 6-week course, which is a night course, which is from 5 p.m. to 10 p.m. And for the first 4 to 5 weeks, you're in class from Monday through Thursday, and it's from 5 to 10 p.m. and you're doing lectures. And usually on Mondays, when we would first come in, we'd take our test, then we'd lecture for what we were going to take a test on Wednesday. And then Tuesdays and Thursdays are skill labs. So that's where you learn how to change your patient, dress them, make an occupied bed, make an unoccupied bed, isolation gown and gloves. We had a skill sheet, and it probably had, I want to say, anywhere from like 15 to like 30 different skills. And then when you do like boards and stuff, you get 3 to 4 skills that you have to do. And then after you've done your lectures and your skills, you do clinicals, which was my favorite part. It was you have a 8-hour shift the first day, then you have a 12-hour shift, then you get a day off, and then you have a 12-hour shift and a 9-hour shift.
Wow. So that's the 6-week program?
That's the 6-week program.
Then you have you mentioned that there's the weekend program, and that's 3 weeks, is that right?
Yeah, that's 3 weeks. I'm not exactly sure how that one works. I know I had a friend who did it, and for some people, that fast-paced learning is what helps them. For me, I would not.
That seems overly intense.
Yeah, I would not be able to focus enough. I'm one of those people that I need to sit down. I like to get all of the information and make sure that I completely absorb it. And for some people, that fast pace, that's how they absorb it. And that was not for me. So I said, absolutely not. I don't care how long it takes. I just want to make sure that I absorb the information for myself. You really, seems like you really want to learn the information, exactly.
Not just dump the information and then try to take a test and then pass it and then move on.
Yeah, well, and then on top of that, I had already done like pre-nursing classes.
Okay.
So I knew, and those were semester-long classes, and I knew how hard those were just in general. And so to put all of what you need to learn as a CNA into 6 weeks was going to be incredibly difficult, and it was. You get home from class, you do your homework, you study, you go to bed. I worked 2 jobs while I was doing this. So I was a nanny, and I did cabinet refinishing. Thank you. It's a really tough experience. It's hard, especially if you're working. That's why a lot of people do weekend courses. But when you do something that is so on like such a time crunch and it's really difficult, and people don't give that enough credit about how difficult the classes are and like what you need to learn, you really learn that you are worth more than you think. Like that was the main thing that I learned, was you just go through these classes and you're like, wow, I'm actually smarter than I thought I was, because it's every Monday and Wednesday you're taking exams.
Sure. They're giving you information, and then you have to remember it, apply it, take the test, and then pass it, and then move on.
Yeah, and specifically at Arizona Medical Training Institute, AMTI, I had incredible instructors. So I had a lecture instructor who obviously did all the lectures. She was amazing. I still talk to her. And I had my skills instructor, and then I had a clinical instructor. So the clinical instructor is the instructor that sees you through clinicals, and that's it's 41 hours, but the first hour is the scavenger hunt. So we get to go around the facility and find things like the fire exit, the fire extinguisher.
It's educational and fun.
Yeah, exactly. And they just try and make it more fun because they know that you're super nervous, because it's the first time you're going to be in contact with real patients. Because when you're doing skills labs, you're working with dummies and you're working with your classmates.
Sure.
Like, you're not...
It's fun. It's
exactly.
Kind of like...
And it kind of like, there's not a lot of tension there because you're with these people all the time. But when it's a patient, it's terrifying.
It's game on.
Exactly. And your first patient is always going to be the scariest. And it's usually going to be the worst situation you could ever possibly be put in for some reason. I don't know why it is. But like my first patient, the situation that we were in was worse
where
than
were
anything.
you? First of all, where were you with your first patient? I mean,
what
setting?
We had to change a patient.
But was it in a hospital?
So we were in a long-term care / rehab.
Got it.
So one wing was a long-term care and one wing was a rehab facility. And when we did clinicals, that's how they do it. You're always at a place that has long-term and rehab.
Sure.
And you work the first 2 days on long-term and then last 2 days on rehab.
So what happened with that first patient?
Well, we went in to change him, and it was just... Have you ever had a baby whose diapers exploded? Like, it was kind of a situation like that, like a blowout.
Having had 3 kids,
yes,
I've had tons. I mean, no, wait. Let me correct you. Let me correct myself. I didn't have 3 kids. My wife had 3 kids. Having care for 3 kids, yes, plenty of blowouts.
It's exactly like that, but supersized because they're an adult. And for me, that never bothered me. That's never bothered me. I am one of those people. I don't get embarrassed for that. And so I was with some other people, and I just jumped right in. I was like, I had just met my CNA who I was going to be working with, and she was like, oh, I'm sorry, you guys don't have to do this. And I was like, what can I do? Where can I help? I just put my gloves on and jumped in, because like, the last thing you want to do is have 2 students who you've never met just sitting there staring at you while this is happening. Like,
sure. If
that was me, I would have been so embarrassed. So I know that what made me feel better was just having someone jump in and not think anything about it. And of course, the patient, he was just, I mean, this is like the normal for them. This is
unfortunately,
right? Unfortunately, it's the normal for them. So it's more so embarrassing for us than it is for them, especially as it's our first time.
Sure.
So he was such a good sport the entire time I was there. He was always so nice.
He knew that you guys are students.
Yeah.
Okay.
They have to. So they prep. So before they accept like students, they prep the patients, especially the ones that are specifically going to be working. But they're kind of used to people coming in and being super intimate with them because
they need your help.
They can't do it themselves. And so you'll have some people that are super, super nice about it. And then you'll have some people that are not super nice about it. And that's okay, because if I was in that situation, I would be so embarrassed. And it's my job to make sure that no matter like what mood you're in, no matter what mood I'm in, that you feel comfortable regardless of the situation. So that's like always how I went into situations was, how would I feel if this was me? Would I be uncomfortable? How could I make myself feel more comfortable? And then I'd kind of project that on them.
Sure.
And try and make them feel as at ease as possible.
Sure. That's so great. Hey, for those of you who are watching on the live stream, please feel free to leave any comments or questions for Mackenzie in the comments below, and we'll be happy to answer them for you. And if you're watching this on a replay, feel free to leave them in the comments. I'll make sure Mackenzie sees it, and maybe we can direct you if you or someone you know is interested in the field of healthcare or becoming a certified nursing assistant. Yeah. So, all right. So the first time, that was your first patient. Mm-hmm. It was kind of a code brown, as we call it.
Exactly.
You handled it with aplomb. No problems. You jump right in, which is awesome. Yeah. And you made sure that the patient was not embarrassed, and you just felt like, yeah, okay, well, this is just the way it is. And
exactly.
So that you don't make him nervous.
Mm-hmm. All right. And like I grew up babysitting. I nanny. And so, and I nanny 3 boys who are now in the stage of their life where they're like, no, we're embarrassed. So I was really used to people kind of shying away from me like that. I wasn't used to people just being so okay with it. So I always walked in with the mentality of they might be embarrassed, so just to try and combat that as best as possible.
Right, so that you want to act natural, like it's nothing, so that they won't feel so self-conscious.
Yeah. Which for me, it actually is. Like for me, none of that stuff bothers me, but it does bother some people, and so some people have a harder time with it. No matter what situation I was in, thankfully, nothing bothered me enough where I had to like walk out of a room or anything like that, because I am just 100% aware like this happens. This is what happens with the human body, and that's okay. And that's how you want to make people feel that what's happening is okay and it's natural and that's okay. It's fine.
Yeah. So it seems like you take care of these people in long-term care facilities who are almost completely dependent, some of them, on people to take care of their almost every need, including feeding, bathing.
Yep. So feeding is different. So a lot of them can feed themselves. Actually, you find that the people that can't feed themselves are usually in the rehab side. Okay. And that's just because they're learning how to rework muscles and how to use things again.
From neurologic injuries and accidents, etc.
Exactly. So they're actually the ones that have the harder time. Usually on the long-term side, it's people that are bedridden or they can't take care of themselves. But they can feed themselves. But you do have people who are really picky about food. And it's kind of like when you go to a long-term care facility, like they have pre-made menus, kind of like school lunches, better. They're better than school lunches, but it's kind of like that. So you're not always going to like what you're served.
Oh, wait, how do you know they're better?
Because I've tried them.
Okay.
Yeah. I had a lady who would not eat what she was eating unless she saw one of the nurses. So I had someone from the cafeteria bring me something that she was eating, and I tasted it because she was scared that it was poison. I had my clinical instructor there and everything. But it was funny. I was like, no, this is fine. But a lot of people don't like what they're going to be served, so they have either people from home bring them food and we keep it in a specific refrigerator, or they can request different things. I had one patient who hated everything that had to do with breakfast food except for Rice Krispie cereals. And so every morning and they still put your food tray out. So every morning we would go back to the cafeteria and get him 3 Rice Krispies and 6 sugars and only 1 little tiny thing of milk. I don't know how he did it, but he did it. And it's just funny things like that. Like, they're still allowed to be themselves. They're still allowed to make choices for themselves. When you're in a long-term care facility, a lot of people think that they don't have, the ability to make the choice for themselves. But they do. And they are allowed to say they don't want to eat. They are allowed to refuse food, to refuse showering, to refuse being changed. They're allowed to do all that because it's their choice, it's their body, and we have to respect that. And if they refuse things like that, it's our job to make them not feel bad because they're refusing. And so that was a tangent, but
from what I'm hearing, it sounds like you really, really take the wishes of the patients in these long-term care facilities and try to give them the dignity that they deserve, and while giving them the food and the bathing, the changing activities of daily living that they may need help with. Yeah. So it's not just bedpans, turning patients and stuff like you. It sounds like you are really invested in what these patients want, and exactly. Based on what I'm hearing, you're telling me that you looked into the details of the wishes of these patients, and as a CNA, that's what you do. That's your job. It's not. Some people in the healthcare setting, you can get burnt out, and that's fine. But the main thing you have to remember is we're all the same. We're all humans. We still all have emotions, and if
it's all about putting yourself into someone else's shoes. And if you are doing something that you wouldn't want done to you or you wouldn't want said to you, then you should really reconsider that. Because at the end of the day, this is your patient. You're supposed to make them feel comfortable. It doesn't matter what you are going through. I had a situation where I had to walk away, and I was upset, and I walked away for a couple minutes, and it didn't matter what happened. After those 2 minutes, I gave myself 2 minutes, and then you go back in and you put on your best face, because they don't get to see a lot of that. When you're in a long-term care facility, you're seeing a lot of people that are like you, and you're seeing these people every single day. And I don't know if you've lived with someone that, you didn't particularly like, but when you do that and you see them every single day, tensions are high. Certain people don't like each other. There's drama. There's a lot of drama with elderly people. People don't think that, but there is. And,
So is it drama with the elderly people and
each other?
With each other. You mean
there's
the
drama,
residents?
Mm-hmm.
Okay.
There's drama between them. There's drama they don't like certain people.
I thought it was drama between the caretaker and...
No, okay. There can be. They can definitely be a little nasty.
So tell me about what made you walk away for 2 minutes. What upset you?
Well, I had a situation where I was working on the rehab side, and there was a patient there who had some sort of dementia or Alzheimer's, and she was convinced that people were trying to kidnap her and that her family was coming for her, but I wasn't aware of this. So all she asked me was, can we take a walk? And I said, yes, of course. And of course, like when you see a student taking a patient, like you're gonna say, stop, no. And so I happened to get yelled at, and then that set her off. And I wasn't bothered by that, but when she got set off, she was really angry and she was upset and she screams at you. And I wasn't mad about the things she was saying. That doesn't bother me. I have really tough skin about that, but it's heartbreaking to watch someone freak out over something they like truly believe. It's their reality. And so for me, I wasn't angry, I wasn't upset. I was more just like hurt for her. And
because she doesn't know any better.
Because she doesn't know any better.
Sure.
And people think that she should. And when you get older, there's some things that you don't necessarily know that you're doing, and you don't necessarily know that you're talking in a certain way. And so I had to walk away because I didn't want to say something to my authoritative figures that was upsetting, because the last thing I want to be is unprofessional.
Sure. And
in situations like that where the tensions are high, it's really easy to become unprofessional because you want to say the first thing that comes to your mind, and that's not always acceptable.
Sure.
And I personally don't think it's ever acceptable to just say what first comes to your mind in any situation. So I walked away. I went to the break room. I sat there, I got some water, and I walked right back out and kept doing my job, because there were other people that needed me.
Sure.
There were other people that they didn't know what had happened, and it wasn't their fault, so I'm not going to take it out on them.
Yeah. Good for you.
Yeah. No, it's
very
it's
mature.
hard. It's really hard. And it's just one of those things where it's like I keep saying, if you didn't want someone to act a certain way to you, then you shouldn't act that way to them.
Certainly.
And especially when you work in long-term care or rehab, like sometimes they're just angry, they're upset, they're going to say things to you that they don't mean. Yeah. And that's okay.
All right. So for those who are interested in getting into a CNA position, is there an age requirement? Do you remember?
Well, I know that there's a program with certain high schools called EVIT, where when you're 16, you can enter it, and by the time you finish high school, you have your CNA. I believe that you can get your CNA at 16, but I think that's state dependent as well.
Sure.
But
then maybe high school, is there a high school graduation requirement or?
No, so for mine, there wasn't really any specific requirements. You kind of just take the class because it's not, I don't want to say it's the lowest part of the medical field, but as far as nursing goes, there's not a whole lot of requirements that you need for it.
It's kind of like an entry position for those who want to test the waters and make sure this is right for you.
Exactly. And it's really good to test the waters with, because you're doing things that some nurses do, but you're doing like the little things that people kind of take for granted. or they don't think is that hard, and it really is. And so if you were trying to figure out if you'd be like a good fit for nurse, a CNA is a really good thing, because once you become a nurse, you learn to respect CNAs so much more.
If you've gone through the
CNA program, because it's a lot harder than people think it is. I've had people like call me like a glorified babysitter or whatever, and that's fine. If you think that's what I am, that is totally okay, because I kind of am. But I am so much more than
You're an adult sitter.
Yeah, exactly. Well, and I'm so much more than that, because, you know, I have to be able to lift patients of certain sizes. I have to be able to do everything myself.
Lift them, turn them,
change them, feed them, dress them, get them into showers.
Personal hygiene, sure.
Mm-hmm, brushing teeth, brushing their hair, doing things. And I know for me, I'm super picky about that. So you also have to have a super good temperament. And that's like one of the main things being a CNA taught me was patience. Like, you have to have so much patience, because there's certain people that aren't going to remember you from 5 minutes from seeing you.
Because of dementia and mental status.
Yeah. Like, I had a patient, he was super cool, super sweet. And I walked in and I said, "Can I shave your face?" And he said, "Yep." And so I came back with my CNA 5 minutes later, and he's like, "What are we doing?" And I was like, "We're going to shave your face." He's like, "Who are you?" And I was like, "Okay." And that happens over and over and over again. And, you know, at first it's comical, but some people kind of get fed up with it. And I'm like, I don't know. I don't see, like, what the point is of getting annoyed over the little stuff.
Agree.
Like, there's so many big things that, you know, are affecting them. Why should the little thing like that, like, annoy you so much? It's like having children when they're, like, in the why stage.
Yeah.
Like,
a lot of patience, like you said,
a lot of patience. And
can you tell me a little bit about any sort of continuing medical education after you get your certification as a CNA? Do you have to?
Yeah. So when you are a CNA, you have your CNA certification, or you can become an LNA, which is a licensed nursing assistant. That's just getting a certain fingerprint card and paying for it. But you have to renew your CNA every 2 years. If you don't, then you obviously have to retake the course. There's not really any further education for a CNA. They might require you to do certain training at your jobs, but that's just job dependent. I'm trying to think. I know for Arizona specifically, it is the state with the least amount of training hours. So if you got certified in Arizona and you wanted to move, the first thing you should know is that the Board of Nursing owns you. So whatever you do, you have to let them know within 10 days. If you don't, you have to retake the course in whatever state you're in.
Such as you moved,
you move, your shoe size changes, you change your last name.
Shoes.
I mean, practically. It's kind of what they keep track of you.
Sure.
And there's also, for anyone that doesn't know this, there is a public record that you can search your nurse's name or their license number if you're in a long-term care facility and you suspect something. On the Arizona State Board of Nursing, you can go and verify a license, and it'll pull up a public record if they've ever gotten arrested or anything like that. If they have good standing, if they're suspended or anything, that's on there. And that's for public record for patients. And
public safety and patient safety.
A lot of people don't know that. And you get told that when you do CNA training. They're like, they own you. Anything you do is put right there.
Wow.
So
don't break. Be a good person and don't break any laws. And
Exactly. It's one of those things where, like, don't break any laws, because everyone will see it.
Yeah, that's awesome. So what are your long-term goals after CNA? Then what? What do you want to do after CNA? Well, first of all, we're looking for a job.
Yeah, so I'm currently looking for a CNA position. I'm just trying to find what's a good fit for me. I'm not.
So where do people usually start after you get your certification? Then what do you do?
Well, I specifically really like working with the elderly. Long term, I want to work in pediatrics, so obviously a hospital job is a must at some point. You'll have a lot of places tell you that it's a requirement for you to have a year experience, whether it's in a long term or assisted living. But I feel like when you work with the elderly or you work in assisted living or anything like that, you gain a lot of respect for getting older. And I can tell you that just from going to clinicals. I talked to my aunt who's turning 72 this year, and she was like, see, this is what I mean. This happens. And I feel like when you kind of do that, you're working with people whose temperaments are not as controlled. And so you learn, I wouldn't like to say a lot more, but for me, I did. Personally, I learned a lot more. But I'm honestly open to any job because it's working with people, it's getting in there, and it's working with patients. And it doesn't matter where I work, I'm still going to love whatever patients I have because that's the part of the job that makes it the best is the patients. I don't care about the pay. I mean, obviously you want a good paying job, but it's not about the money. It's not about the facility. It's about the patient. And that's the part that I'm most excited about.
All right. Speaking about pay, tell us about in Arizona, what is the range for?
That depends on where you work, but it can be anywhere from 11 to anywhere around like 19, 20. Most places offer $12.50 for starting. And
I know, I looked it up. I know it's dependent on where you live, the state, and things like that. I think Alaska pays the most.
Yeah, there's a lot of states.
And then second one is New York.
Yeah, so there are states that pay really well, and then there are states that don't, and that's fine. But for me personally, I would say anywhere, like if you're a CNA and you're looking for a job like I am, I would say anywhere between 13 and 16 is where you should draw the line. If they want to offer you less, you're worth more than that. The training you've been through, the stuff you have to do, you're worth more than that. And if they can't see that, then that's on them. They're losing out on a great CNA.
I am so happy that you understand your self-worth and you understand that you are worth
well,
your time is worth something. That's good for you.
Yeah, it's really important to know that what you're doing and what you're going to be doing every day, it's exhausting. And some people don't realize how exhausting it is. And
but you also have to temper that with what the market will bear, right?
Exactly.
Depending on the market, it may or may not pay the amount that you want, that you feel that you're worth.
Exactly. Well, that's why, like, when you go through and you look at like what you want to be paid, I sat down and I thought about it a lot. I looked at the lowest and I looked at the highest, and I thought, you know what? I could be cocky and I could say, oh, I'm worth the $19, or I could kind of look down on myself and say, oh, no, I'm only worth the 11. But that's not the case, is most people are worth somewhere in the middle.
Sure. And
so when you give a range, obviously, sometimes you want to highball it. So that's the $16. And then there's the $13. You have a range for yourself.
It's all part of negotiations. Just like in real life.
Exactly.
I mean, it is real life.
It is, but you definitely should always have a range, not just one set number. Because if you go in with one set number, you're going to be disappointed.
Sure. Be flexible. The bottom line is be flexible.
And to know your worth, but also know that you might not be able to get that, and that's okay. And just make sure when you're going to jobs that there's room for growth. That's the main thing that I've been told, is make sure there's room for growth in your pay and your position, because you don't just want to start something and then just stay there, unless that's what you want it. Unless being a CNA is exactly what you want to do with your life. And for some people it is, and that's amazing because we need so many more CNAs. But if you want room for growth, then you talk about that in your interview, or when you start working, you make sure that there's definitely room for that.
Yeah, based on my little bit of research, there seems to be a shortage.
Yeah,
of CNAs.
There's not a lot, and then but for me personally, to get back to your question, because I go off on so many tangents.
That's okay.
My further education is I'm going to get my RN, and then my bachelor's in nursing, and then at some point get my nurse practitioners. That's the goal. It might change, but the reason that I decided on that, because I was like, I'm going to stop at RN, but I decided to keep going because if you go through all the positions and you decide that you liked one that was lower or higher than the other, then you can do that. You can go back. But I want to have so many options open for me. And I'm only 21. And I have so many years. And I learned when I first started college that it's not about how fast you complete something. It's about, it doesn't matter how long it takes. It's about getting there and doing well to get there. Because when my first year of college, I stressed out so much. I freaked out. I wanted straight A's. And it's impossible when you take on something so big in such a little time, because I was like, I'm going to get my BSN in 2 years. Impossible. Yeah. It's exhausting. And I was working a job. And so I just decided that however long it takes me, that's how long it takes me. If I don't get my nurse practitioners until I'm in my 40s, I don't get my nurse practitioners until I'm in my 40s. Because I want to enjoy the positions I'm in, and I want to enjoy the life that I have, and I want to enjoy the patients that I have. And I think that's just really important, is to, a lot of people don't tell, especially younger kids, that it's okay to take longer than everyone else. You don't have to graduate in 4 years. You don't have to have this huge plan, because plans don't always work out.
I think a lot of it is that as an Asian family, right? My parents always said, oh, I want you to be a doctor, I want you to be a lawyer, I want you to be an engineer. But I did not go that path. I went and worked and did other stuff. And then finally, I decided, maybe I'll give medicine a try. And that's how I ended up here. But you mentioned something a little earlier, which is, I thought it was very insightful. You listened to your older patients that you care for, and you learn from their experiences, what the things that they were telling you. I will tell you, I learn every day from my patients based on what they've gone through, their life experiences, what they're going through right now, the struggles that they're going through, and I'm taking notes, because eventually I'm going to get there, right?
Yeah, exactly.
We all will get there. And if I learn about their mistakes and their regrets, it'll allow me to do things so that I won't make those same mistakes, and I won't have those regrets. So what you said, learning from these older folks that you take care of, is so insightful, so smart. Yeah. And the other thing you said, I thought was very insightful, is that patience to get to where you want to go, instead of, I want to get there in 2 years, BSN in 2 years, and you're enjoying the journey.
Exactly.
And you are checking things out to make sure this is truly what you want to do, instead of, let's just get there. Whose expectations are you trying to meet, right?
Exactly.
Why do you need to get there that fast?
Well, and I thought for a really long time that if I didn't do this, I was going to disappoint my family, my dad, my godfather. I was so scared of that. And I remember going to my dad one day, and I was like, I don't want to do this anymore. I don't want to be in medicine anymore. And my dad was like, okay. He's like, is that really what you want? And I said, I don't know.
So he does really have it's like, seems like you said expectations for other people. It seems like you put those expectations.
They were only my expectations
in your head.
And when I talked to my dad, I eventually decided on going back to the medical field. But, and I didn't quit school. I didn't do anything. I talked to my dad about it, and I said, I'm so worried about disappointing. And he said, you're doing better than all of us ever could have hoped. He said, we just want you to do better than us. That's the thing, is we want you to have a better life, to do better than us. And I grew up with my dad being so incredibly open and inspiring, and just being one of those people that whatever you want to do, it's about making yourself happy. Don't worry about what anyone else thinks. Don't worry about how long it's going to take. It's about the journey of getting there. And so if it weren't for him, I don't know what I would be doing. He is a constant support. He is a constant study buddy. He is just constantly there to remind me that no matter what I'm doing my best, and that's what's important. But that's the main reason of why I know that the journey is the important part, is because my dad. My
wife and I tell our kids all the time, as long as you try your best, whatever you do, that's fine. Just do you, and not live your life according to somebody else's, looking through somebody else's lenses and through somebody else's standards. And same with my parents. My dad, we immigrated to the States, and then really the only reason he moved our whole family here is just so that we could, my siblings and I could have a better life.
Exactly.
So true. I think every generation, we all want to do better so that our kids, the next generation, can do better and enjoy their lives more.
And that's like that was the best part, is going through the CNA program. I would come home, or I would text my dad after every exam and be like, I got another A, or I got a 90, or whatever. And my dad would always send me, there's the Bitmoji thing now. He'd always have one of those to send back to me, or such encouraging
Wait, how old
words.
is your dad?
He's, oh gosh, Dad, you're watching. How old are you? Like 54, 55?
And he's doing Bitmojis?
Yes, he loves Bitmojis.
He's hip.
He is. He loves Bitmojis. But some of the things, like some of the acronyms that the Bitmojis use, I don't know if he knows exactly what they mean. But I'm not sure. But to have a huge support system is the main thing. But most importantly, like when you're doing something like this or anything in your life, it's really important to have, obviously, your support system, but more importantly, support yourself and know your worth and know that your best is important.
Sure.
So my dad just commented emojis.
All right. Charles mentioned, let's see, James said, hi, John and Mackenzie. Hello, James. And hello, Susan, Khan, Laura. Thank you so much for watching. And Charles said, I'm so proud of you. And you go, girl, passion work.
I told you he's so supportive.
Dad says he's 56.
Oh, you're 56. Well, I gave you 2 years. You shouldn't have commented. How rude for yourself.
All right. For those of you guys who are watching on the replay, feel free to leave any questions about CNAs. I hope Mackenzie's experience in getting her CNA certification has been helpful to you. If you need to, if you're interested in hiring Mackenzie, please, I'm sure you can find her on here and directly contact her, or you can leave in the comments and we'll make sure that she gets your message. Is there anything you would like to add? Any parting words to share with our audience?
I think they pretty much got a gist of me because I go off on so many tangents, but no, just thank you so much for giving me this opportunity. It's been so fun.
Well, thank you so much for coming on the show and spending time and sharing your experience with the audience. I wish you the best of luck.
Thank you.
I look forward to seeing what you've accomplished in the future, 20 years from now, and I would love to play back this video. And,
oh my gosh,
and
how embarrassing in 20 years.
And see where you've gone and what happens to you. So congratulations on turning 21 and passing your certification.
Thank you so much.
I'm looking forward to seeing where you end up and what you end up accomplishing. Thank you all so much for watching. Have a good night.